As a teenager, my next guest suffered a slew of mental health issues: crippling anxiety, depression, ADHD, and autism. At 15, she had a manic episode, landing her in the hospital. Well, that's where she says after just one meeting, a psychiatrist coerced her into saying that she was transgender. Now, she had questioned her gender identity at the time, but now she says that she really started exploring it. Soon after, Soren Aldaco was at a support group where she met a nurse practitioner who she says prescribes testosterone upon request. After only a 30-minute meeting, she got her first prescription for cross-sex hormones, including at an outrageously large off-label dosage of testosterone. Soren at the time was just 17. So fast forward to age 19. After a brief phone call and a quick visit to a clinic, she went under the knife, getting a double mastectomy. But the surgery was botched, leaving her disfigured and in severe pain. She's now 21 and suing all of the healthcare providers who preyed upon her as a teen. She joins us now exclusively. Soren Aldaco, along with her attorney, Ron Miller. Soren, thank you very much for having the courage to share your story with us. Now, 2 weeks after the double mastectomy, I know you were back at the hospital. What happened?
So I ended up going back to the hospital after reaching out to the clinic initially with my concerns. I chose to go to the hospital in Dallas because they had someone who had experienced the type of surgery I underwent. And when I showed up to the hospital, they took me seriously, which was a huge contrast to the way that my original surgeons treated me. When I showed up there, I was put. My incisions were reopened with only local anesthesia, and I was there all night.
Soren, after that, did the clinic offer you any sort of compensation? That is a horrific, I can't believe you went through this. Any compensation?
Yeah, well, we did talk afterwards by email, and after I was persistent and, very insistently letting them know that I wanted some sort of recourse, the CEO reached out to me and offered to reimburse me for the ER visit with the stipulation that I sign a non-disparagement agreement, which I, of course, did not. I told them, I asked them, what have you done to make sure that this doesn't happen to any other person? Have you spoken to your nurses? Do you plan on doing any sort of training? And at that point, they ghosted me.
And what did they offer you, like a couple $100 or?
Yeah, basically.
to sign a waiver that you wouldn't sue them, probably. Now, Ron, given Soren's psychological condition at the time that this was all happening, how do you legally view what these medical professionals did to her?
Well, Laura, it's just a matter of gross malpractice. This is a situation where Soren experiencing these significant mental health issues, autism, really just looking for a place to fit in amongst her peers, goes to the internet and finds some stuff about becoming transgender. She reaches out to a medical practitioner expecting competent and unbiased advice, and instead gets put on a fast track to puberty blockers and cross-sex hormones. And then, as you just discussed, a botched double mastectomy that has left her permanently disfigured for the rest of her life.
Soren, what do you say tonight to young people who may feel, upset in their lives, confused, who are in this same situation and feel pressured to undergo this type of procedure, surgery, hormone blockers? What do you say to young people tonight?
Ask the important questions. You're not compromising your integrity or betraying yourself by thinking critically about what's happened to you, by unpacking why you feel the way you feel instead of just accepting it at face value.
And Soren, how are you doing now? Like right now, how are you doing?
I'm a little bit nervous.
No, you did.
I want to. Thank you. Well, it's like I want to change the world. I mean, I think a lot of people feel that way, but I want to make sure that, you know, this conversation is spoken about and talked about compassionately, because I really do think that a bunch of people are hurting, and the way we're handling it right now is just not appropriate. And, you know, I like to describe myself as a student of life, friend of the world, and I mean that. So, you know, when I come on air to talk to you, I really want, you know, I joked earlier, for everybody to kind of kumbaya and not fight so much over something that really should be nonpartisan.
Well, Soren and Ron, thank you. These are, in many cases, these are children. They're not even as old as Soren was, and they need care and concern. Soren and Ron will be following your case. Thank you.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.